So this is a technique for lumbar spine unloading. So as to which tissues you decide to unload will depend upon where you feel or find excessive tension in the muscles in question. And we're going to focus on lumbar erector spinae and also quadratus lumborum. So to get hands on and feel the tissues, then for lumbar erector spinae, feel whereabouts the lumbar SPs are, and then with the heel of your hand, just reinforce and just sink into the tissues and really try and get a sense of where there's excessive tension, where there's more tone. And you're going to palpate both left and right hand sides. To palpate QL, then posterior iliac crest up towards the 12th rib, they're going to be your landmarks in question, and also your TPs of your lumbar spine. And then to feel the border, because it travels up and it's going in a medial direction, up in following my fingers, then to engage and feel the lateral border, you can sink your finger pads in, reinforce them, and then just drag the tissues back towards you. And where you feel some tension, that will be the lateral border of QL. You can also use your pisiform and your ulnar border to get your hands in, and again that will be another way to feel the levels of tension in that tissue. So you'll tape where you find tension. It might be that it's on both erector spinae and both QL. It might be it's unilateral. For the purpose of this demonstration, then we're going to tape both left erector spinae and also left QL. So we're using 5 centimetre fixation mesh, and this is just simply applied following the length of the tissues that we're trying to tape. So make sure you've got access to far enough inferiorly to feel the top of the sacrum. Make sure you're lateral to spinous process of your lumbar spine, and all we're going to do is literally lay this in the skin, try and avoid any creasing, and lay it down nice and smoothly. To follow QL, then we're using fixation mesh again, and it's starting on the posterior iliac crest, just about here, and it's going to travel up towards the 12th rib, again free from any tension in the tape so far. So that's just being applied directly onto the skin, and we're going to put zinc oxide tape over the top of it. So with our zinc oxide, then this is where we're going to really approximate tissues, move them close together to try and offload them. So we're going to start at the distal end of our first strip, hold it down, and then add tension through the tape and lift and squeeze, and then we can stick it down here, and you can see this creasing in the fixation mesh underneath it. There's also a small amount of creasing in the skin, which is exactly what we're after. And we're going to do this section by section, slowly incorporating tension. You can ensure you've got that by feeling the tape. And for the final bit on our first strip, we're going to move the tissues down and then attach into the superior side just here. And again, upon pressure, all that tape feels under a fair bit of tension. For the strip over QL, then it'll be the same principle. We're going to start on the posterior iliac crest, attach into fixation mesh, hold the tape down, add your tension, and then stick it down. Again, we can see creasing the tape underneath it and also in the skin. Bring it up to halfway, and the final bit, move the tissues back down towards where we started and just stick down your zinc oxide tape here. It will be a technique that would benefit from having adhesive spray put on beforehand, just for longevity and also to reduce the risk of that tape coming detached.